Some research on B12. These are human studies. So I like to always show you some different studies. These are a few newer ones that have come out. And you can see this is a randomized placebo-controlled trial using methyl B12, which is a really solid form of vitamin B12 for children with autistic disease. And so it's a small study, but it's 57 children with autism were randomly assigned to 8 weeks of treatment with 75 micrograms per kilogram of methylcobalamin or a saline placebo every 3 days as an injection. So this was an injectable vitamin B12. And so you can see the conclusion: methyl B12 treatment improved clinician-rated symptoms of autism that were correlated with improvements in measures of methionine metabolism and cellular methylation capacity. Basically, doctors saw improvement in their patients taking injectable vitamin B12. Does that mean that B12 is going to cure autism? No. But does it mean that if your child is autistic that you might consider asking your doctor to measure B12 to see if your child could have a better outcome? Absolutely. This is another research study done in humans, 50 patients with relapsing, remitting multiple sclerosis. They had a vitamin group who received 5 milligrams of folic acid tablet and 3 doses of vitamin B12, 1,000 microgram injection, and another group that received a placebo. And what the outcomes were, both physical and mental fields of quality of life were improved significantly in the vitamin group. Serum homocysteine levels decreased and anemia status improved with vitamin B12 and folate supplementation, reveal the potential role of these two vitamins in improving the quality of life in multiple sclerosis patients. I would even go so far as to say MS, some cases of MS, so if you've heard of multiple sclerosis, some cases are actually vitamin B12 deficiencies in disguise. There are some people, I have seen cases of MS where they actually had such a severe vitamin B12 deficiency that B12 deficiency helped correct the problem. I've seen people throw away their walker and get out of wheelchairs as a result of just getting adequate B12 in them. So don't underestimate the power of nutrition. If you've been diagnosed with MS, ask your doctor to measure your B vitamin levels, particularly your B12, and see if it's right for you. Okay, this is another research study. This is a relatively new one done on they call it ultra-high dose methylcobalamin in patients with early stage ALS or Lou Gehrig's disease, also known as amyotrophic lateral sclerosis. So in this study, they did an intramuscular injection of methylcobalamin at 50 milligrams. That's a pretty hefty dose. And they did that for 16 weeks versus a placebo. Well, here's what they found. Results of this randomized clinical trial showed that ultra-high dose methylcobalamin was efficacious in slowing functional decline in patients with early stage ALS and with moderate progression rate, and was safe to use during the 16-week treatment period. So they used ultra-high doses of B12. It was safe, and they had better outcomes and a decline in basically in deterioration of these patients. By the way, ALS is a very tortuous disease, and it's very, very hard to treat. I lost my stepfather to ALS, and so this was before I became a doctor, but it's very, very tough to treat, and it can be very heartbreaking. So any therapeutic advantage that you can get is a good one. In this case, high doses of vitamin B12. So if you know somebody with ALS, share that article with them. Okay, let's look at some of the mechanisms to the whys. We talked about some of the symptoms of B12 deficiency and what happens and what manifests and what you feel, but let's talk about kind of some of the why. This is going to be fun for some of you that like to geek out a little bit more on science. So what we're looking at here, you can blow up this diagram, this is a very clinical diagram, but you can see up here some of the reasons why vitamin B12 absorption is hindered. Now, we've covered this already, but this is just kind of, in summary, a diagrammatic version of that. So antibodies, this is autoimmune disease in the stomach, pernicious anemia and atrophic gastritis, both autoimmune diseases. Remember what I said before, gluten, major trigger here. Get that gluten out of your diet if you've had that diagnosis. Lack of terminal ileum or disease of the ileum, such as Crohn's disease, and then obviously a reduced B12 intake, plant-based diet, or concomitant pregnancy. So something we really haven't talked about yet is pregnancy. The demand for vitamin B12 goes up during pregnancy because of the massive amount of growth that a woman is having with the fetus. The cells are replicating, and you need the DNA turnover for that, and that's what vitamin B12 helps do. So those of you who are pregnant, check your vitamin B12 levels, because deficiency can lead to a number of different disorders, especially of the neural tube, so like spina bifida and others that are quite common as a result of B12 deficits. Now, I know a lot of you are taking folate when you're pregnant, but remember, one of the reasons why vitamin B12 is so important is because vitamin B12 helps to activate folate. And so if you're low in vitamin B12, you can't activate folate and you become folate deficient. There's a name for that. It's actually called the folate trap. It's when you don't have adequate B12 to activate your folate. Now, there are a couple of major chemical reactions in humans that vitamin B12 plays a role in. One is in this substance here called methylmalonyl-CoA. You need vitamin B12 to convert this chemical into another chemical called succinyl-CoA, which is an important cofactor for the, maybe I'm getting too biochemical here, the TCA cycle, which is the cycle inside your cells that helps you generate energy. So think of this is what we always talk about. B vitamins, they're important for energy. And if you don't have enough B12, what happens is this chemical called methylmalonic acid will accumulate and in your tissue, because it can't be converted properly into this other chemical. And when you have high MMA, you get nerve damage. So this is why you don't want that. You get demyelinization of the dorsal and lateral spinal columns, which can contribute to a lot of the symptoms that you see here, the ataxia, the balance problems, the dizzy problems, the loss of position sense, and the loss of vibration sensation, which we talked about earlier. So this is one of the biochemical roles of vitamin B12. And so one of the ways that doctors will measure B12 as a consequence is they'll measure this chemical called MMA, methylmalonic acid. Now the other over here, you can see vitamin B12 plays a role in, I know if you've watched me for any length of time, you've heard me talk about homocysteine. Homocysteine is like an exhaust byproduct of the methylation cycle. We all make it. It's like that all cars produce exhaust. All humans make homocysteine. But we get rid of homocysteine. We don't want the exhaust to build up because it'll choke us. And so through vitamin B12, methylcobalamin, we convert homocysteine into something called methionine. And why is that important? Because methionine helps us to make and convert, it helps us to activate folate. So what I was just talking about a minute ago. But DNA production, basically it helps us to replicate DNA so that we can repair old cells or build new cells. And so if we can't do that, we end up with low cell production. This is why, as I mentioned earlier, some people with low B12 end up with low red blood cells, low white blood cells, and low platelets because of this mechanism right here. And this is where they end up with a number of different types of anemia, what we call macrocytic anemia. Macro means large, cytic means cell, so it's a large cell anemia, otherwise sometimes referred to as a megaloblastic anemia. Going back to homocysteine, so when we can't get rid of the homocysteine, you see high plasma homocysteine. This is another test your doctor can run. It's a surrogate marker for vitamin B12 deficiency. And high levels of homocysteine can contribute to atherosclerosis, which is a form of cardiovascular disease, thromboembolism, osteoporosis. But that's not all. This is actually, homocysteine is a risk factor for diabetes, and it's a risk factor for cancer. You don't want those things. So this is why vitamin B12 is so important. It runs these different enzymatic mechanisms that have very important functions inside your body that help maintain your body's health. So hopefully those of you that really like chemistry had fun with that. Now, let's kind of summarize more of a visual here. You can see here in the center of this diagram, you can see the bullseye is vitamin B12 is low. And so when B12 is low, there are a number of different things that we've seen happen as a consequence of low B12. Ultimately, what happens at the end, on the end stage, on the outside, you can see inflammation, decreased tissue recovery, leading to unhealthy aging. So I'm going to skip the inside chemistry. You can see here, you have methylation problems, methyl inflammation that leads to the increased risk of tumor formation, so cancers. Okay, and then up here, you've got degenerative disease, age-related diseases, inflammation, and what they call inflammaging, which is accelerated aging as a result of inflammation. So these are all consequences biochemically of having low levels of vitamin B12. Those of you that want to go back and look more at this, take a snapshot of this, and you can go back and study it more. But I'm not going to go more into too much chemistry. I think I'll lose almost all of you if I do that. Okay, I was talking earlier about methyl trapping or folate trapping. So this is another diagram of vitamin, or actually this process up here is the biochemical process of methylation. I'm just going to call out one thing, which is right here. This is vitamin B12. And what I said earlier is that vitamin B12 helps take dietary folate, you see the arrows going this way, and it converts it into something called tetrahydrofolate. Why is that important? Because this is the folate that helps you make new DNA. This is the folate that helps drive a lot of the mechanisms in your body. And if you don't have B12, in the absence of vitamin B12, your 5-methylfolate becomes metabolically trapped in this form, producing a pseudo-folate deficient state. And why is that a problem? Because a lot of doctors will do folic acid testing, right? They'll test your folic acid. They'll measure folic acid in your blood. And if it's normal, it could be not normal. It could be that you have plenty folate, but if your vitamin B12 is deficient, that folate doesn't get activated, it's trapped, and your body's going to start behaving as if it's got a folate deficiency. So remember, vitamin B12 deficiency can mimic folate deficiency. These two go hand in hand. They're very, very important in that regard. Okay. We were talking about homocysteine a minute ago, and I said that homocysteine is something that your doctor can measure. HCY is homocysteine. So you can see here, low vitamin B12 causes elevated homocysteine. These are all of the things linked to elevations in homocysteine. And again, I'm going to spell this for you because I think it's one of those you want to just take notes about. Write it down and ask your doctor to check your homocysteine levels. This is a standard test. Insurance covers it. You can have it done on an annual checkup. You want your homocysteine levels to be below 9. If they're not below 9, consider some of these factors, that you either have low vitamin B12, low vitamin B9, low vitamin B6, low omega-3s, or a renal problem. Renal problem means kidney problem. A lot of people with kidney damage have an impairment in their ability to get rid of homocysteine. So these are the major factors. And then look at all the disease linkages here. Cardiovascular death, thrombosis, bone fracture, cancer, DNA damage, telomere shortening, which reduces your lifespan, endothelial dysfunction, which is the endothelial lining is the lining inside of your blood vessels, and those start to clog and become inflamed. A lot of you think cholesterol is what causes your arteries to clot. And in reality, homocysteine is what causes your arteries to clot. Let me pause and show you how that happens very quickly, so that you can quit obsessing over cholesterol. A lot of these doctors are obsessing over cholesterol incorrectly, and they're doing the wrong thing. So if this is a blood vessel, and this is the endothelial lining, so think of little cells that line the edges of your blood vessel. And so what happens is too much homocysteine in your blood will damage these cells. And so as the cells get damaged, your body will start to lie down a plaque to try to repair the damage. And part of what that plaque is comprised of is cholesterol. That's why they fear cholesterol. But it's not the cholesterol that's the culprit. It's the elevated homocysteine causing the damage to the vessel that is. So it's more important to go one step backwards. Don't blame the cholesterol for showing up where it's needed. Look at homocysteine as a risk factor for something that's driving that atherosclerosis. And then we have, again, other risk factors: cognitive decline, dementia, Alzheimer's, and stroke. So homocysteine is no joke. You absolutely want to make sure that your levels are normal. And it's a very easy test to perform. Ask your doctor. Your insurance covers it, as I said before, and it gives you a good insight or a good indicator for a lot of risk. Okay, this is one of the other. I've talked about anemia a number of times, and so this is a diagram of basically of cells, of the blood element cells in your body. We're not going to go too deep, but I just want to draw you some concepts here. So this is. You see here where it says in red bone marrow. So these cells are all present in your bone marrow. And so, you've got all these different cell names, but predominantly what I want you to understand is there's a stem cell, this one right here. It is a precursor to your red blood cells, also known as erythrocytes. So if you come down here on the bottom left of this diagram, you see that it says erythrocyte. That's a red blood cell. And so what happens is the stem cells in your bone marrow produce red blood cells. They also produce platelets, and then they also produce the white blood cells. These are just the different types of white blood cells. So this process of stimulating stem cells in your bone marrow to make red blood cells, platelets, and white blood cells, this process requires vitamin B12 and folate being vitamin B9. So if you do not have adequate B12 or folate, what happens is you get trapped. You get trapped up here. And this is why your red blood cell counts, this is why they're low, or one of the reasons why they can come back low. This is why you can have anemia. Going back to, let's draw you another picture here. You've got, here's my bone. Inside you've got the marrow. The marrow contains stem cells. When the stem cells come out of the marrow, they're very large when we're talking about red blood cells, and they have to mature. And as they mature, they get smaller. And then ultimately they take on a different shape. They lose their nucleus and they take on what's called a biconcave shape, which is how we carry oxygen in this divot. This little divot is what allows us to carry oxygen. So this is the process of a red blood cell maturation, right? So maturation of a red blood cell occurs out of the bone marrow stem cells. And this process here also requires vitamin B12, vitamin B6, and folate. It also requires iron and copper. And this is one of the reasons why deficiencies of these nutrients can lead to anemias. Remember what anemias are. Anemias are diseases where the red blood cells are either too large. In this case, too large of a red blood cell, we would call that macrocytic, too large. And then we can have too small of a red blood cell. So if they're too small, we call that microcytic anemia. Bottom line is, the simplicity of it is you have stem cells in your bone marrow that without B12 can't form mature red blood cells. And when you can't form mature red blood cells, you can't carry oxygen to your tissues. When you don't have oxygen going to your tissues, the consequence of that is pain, shortness of breath, anxiety, brain fog, severe fatigue. These are the symptoms of anemia. And so if you're struggling here and you don't know why, and your doctor a lot of doctors will run a test called a CBC. The CBC stands for complete blood count. And the CBC measures your red blood cells. It measures a red blood cell size, measures the quantity, the size, and the shape. But there's one marker in particular called an MCV. MCV stands for mean corpuscular volume. It's the size of your red blood cells. And if your MCV is higher than 99, it means you're stuck here. Your red blood cells are too large and you're not carrying oxygen very well. And this is most likely vitamin B12 deficiency. So this is another simple test you can order. Doctors can order it. It's a CBC, and you get that MCV number. And if it's over 99, a lot of times I get this all the time. Patients come to me and they bring me their blood work from their exam or their checkup, and they've got this MCV value, and it's like 102, 103. And I said, well, did your doctor talk to you about this? And they say, well, no. He said it was just fine. He said it was normal. And the way I interpret that is that doctor was neglectful in his duty to help that patient understand the abnormality in the blood work, because that's a very dangerous thing. Having an elevated MCV and not knowing why or not addressing it can lead to a lot of health problems. If you think about that, if you're having these problems and you're not taking the B12 to correct the anemia, the doctor's going to want to prescribe pain meds, possibly asthma inhalers. You might want to call it asthma when you're short of breath. He's going to want to prescribe anti-anxiety drugs. He's going to prescribe stimulants like Ritalin because of your symptoms, right? So it's see symptom, treat symptom instead of understanding why symptom exists. And I think it's important that you understand this because this is one of the most common manifestations of a vitamin B12 deficiency that's easily detectable with simple labs.